Good morning to all. Today we are going to discuss about a very important module that is about from the topic of nutrition. So basically from nutrition you will be getting two types of questions. The first is that they will give you a patient with some nutritionally deprived state, and what type of nutrition will you take for this patient, like whether you will go for a peg, whether you'll go for a central line, whether you go for parental nutrition or enteral nutrition. Okay, so that is the type of nutrition. And the second question that is usually asked here is about the ERAS protocol, and the third new topic that is asked is the electrolyte disorders. Okay, so before going to this, let's discuss about this question, which is a model question. A patient underwent gastrectomy and was on fluid therapy post-operatively. There was a delay of 10 days before initiation of TPN. So what's the most common electrolyte disturbance seen? The answer here is hypophosphatemia, and let's discuss this topic. So this topic is the topic of refeeding syndrome. So what is refeeding syndrome? So most of the surgical patients that we see in the clinic are either suffering from cancers or suffering from chronic malnutrition. So these patients are starved and they are cachexic. So what happens is, when these patients report to the clinic and the physician or the surgeon starts them on nutrition, if they have not identified the starvation state or the catabolic state in the patient, then they can overfeed the patient, which leads to refeeding syndrome. Which can lead to refeeding syndrome. So let's talk few things about the starvation. So whenever we received a patient, whenever they starved, so in the first 0 to 24 hours, these patients will lose all the glucose stores in their body, and then during the 24 to 48 hours, so basically the amino acid pool will take over from the muscles and the liver. Glycogen will be broken down and gluconeogenesis will be happening. And beyond 48 hours, the fats will be used for as a source of energy. So the fats will be broken down, and these fats will be yielding the glycerol, and then that will be eating the fatty acid, and from there ketones, and ketones will be used as substrate for the body. So what happens is that during this phase of 3 to 5 days, the patients are going into a catabolic state. So whenever the patients are going into a catabolic state, they lose electrolytes, they lose weight, they lose muscle mass. So consider this is a cell, and during the catabolic process, the potassium, magnesium, phosphorus, they all will be forced to move out of the cell, because there is no activity going inside the cell. There is no need to produce energy. The resting energy expenditure has reduced. So what happens is that when you feed these patients with a lot of nutrition, be it a enteral nutrition or be it an parenteral nutrition, so you are causing a state of excess of glucose, which causes reflex of excess of insulin, and this insulin shifts all the electrolytes again drastically inside the cell. So this causes sudden shift in the electrolyte balances, and that's leading to what is known as the refeeding syndrome. If the refeeding syndrome is not identified in prompt time, this can be fatal and the patients might die. And this disease often mimics what is known as the Wernicke's course of psychosis, which is due to the B1 deficiency, because thiamine is very much vitamin which will be also lost during starvation. So, how to prevent refeeding syndrome? The best way to prevent refeeding syndrome is to identify those patients who are prone to get this refeeding syndrome, and those risk factors, if you see, that can be a BMI which is less than 18.5, or those patients who are nil per oral for more than 5 to 10 days, and those patients who are already having electrolyte or vitamin deficiencies, or a patient of alcohol abuse. So in these patients, when you are going to start nutrition, you have to start at a lower range of 10 kilocalories per kg per day, and then slowly increase over the next 4 to 7 days to 20 to 30 kilocalories per kg per day. And then you have to monitor these patients for all the electrolyte disorders, and you have to treat the electrolytes simultaneously. So this is the importance of this topic, because this topic is very frequently asked in the MRCS exam as well as the NeXT and the NEET exams. So the answer to this question was hypophosphatemia. The hallmark of refeeding syndrome